Good morning, everyone. Welcome to the webinar for behavioral health services that's been issued through the Chicago Department of Family and Support Services. I am Raysana Riley, and I will be conducting the webinar presentation. Before we get started, just a few housekeeping items. On the right, you should be able to see your dashboard. And we have a handout of the PowerPoint in PDF, and you can download that. You can download the RFP at your convenience. Also, please type in any questions that you may have. We won't answer questions until the end of the presentation. However, you can keep them coming, and again, we'll get to them at the end. You can also please let me know if we need to turn up the volume, or if for any reason, you can't see or hear anything, or other technical difficulties, just to make us aware. And so once again, welcome and thanks for joining us, and I'm going to go ahead and get started. Okay, so on your screen, you should see the agenda, and so these are all of the areas that we're going to cover within the PowerPoint today. So program purpose and components, service areas and focus populations, outcomes and outputs, delegate agents and qualifications. We're going to talk a little bit about the new e-procurement system, the budget, and again, we'll take questions and provide you with answers at the end of the presentation. Okay, so the purpose of BHS. So many youth and young adults experience mental, emotional, and behavioral disorders while also lacking access to resource and/or understanding of what resources are available. So therefore, the purpose of this RFP is to fund the provision of counseling and treatment to eligible Chicago youth with mental, emotional, and behavioral health impairments or disorders. So just a brief description of the program. Behavioral Health Services provides outpatient mental health counseling. Again, that's outpatient mental health counseling for youth who have mental disorders, behavioral issues, and/or emotional impairments that prevent them from living a healthy life where they can effectively function in school, at work, and in their communities. A healthy life is characterized as youth achieving developmental and emotional milestones, healthy social development, and effective coping skills. The goal of any of the services provided under the BHS contract is to decrease youth's impairments, increase their understanding and use of coping mechanisms and skills, and help them create an action plan so they can continue to improve quality of life. And so what we mean by that, of course, is that we want young people performing at their best at school, in their homes, and in community. We want to see youth graduate from high school and pursuing post-secondary educational opportunities, and we want to also see them displaying appropriate behavior in school, home, and again, in community. When we say that we want to help them create an action plan within our counseling model, and we'll get to that a little bit later, but within our counseling model, we talk about youth receiving an assessment and then an action plan being created in conjunction with their counselor to help them, again, attain some of the milestones that are and the goals that are set within the counseling services. So we're going to move on to service areas. This year, there are 6 key focus areas that DFSS will give preference to for funding, and we're going to talk about specifically those 6 on the next coming slide, but let me just get to some other service areas as well. We want to let you know that you may submit a variety of proposals in response to the Behavioral Health Services RFP, including those for general mental health counseling. Agencies are required to complete a separate proposal for each focus area they submit, and agencies may submit up to 3 proposals. Now, with that being said, we want to let you know that no more than 60% of awards given will be under the general mental health counseling services model. And so getting to those service areas, we're really looking for services that cover the areas of anger management, care coordination, psychiatric services, sexual abuse counseling, sexual identification and orientation, and substance abuse counseling. And so in the RFP, you will find actual descriptions of what these service areas are. I mean, I'm sure that all of you are experts in your fields and you probably already know, but we do offer an explanation within the RFP. Ideal respondents will have a deep understanding of the focus populations above and will have demonstrated experience in engaging and providing counseling services to youth in these areas. Let me also say before I go to the next screen is that when we were writing this RFP, we really had the thought in mind that our delegate agencies, our current delegate agencies, and other organizations that may provide behavioral health services, we really do genuinely consider you guys the expert in this arena. And so if you have some counseling services out there that are not necessarily listed under these service areas, we are still happy to hear from you. We are still happy to read your proposals and consider you for the awards. So these are just some that we picked out that we thought, you know, were important based on some research that has been done. So BHS program components. DFSS recognizes that counseling takes on various forms and can last months or years. So counseling can be provided in the form of individual, group, or family therapy. For the family therapy, as long as the client or the young person, you know, is at the center of attention and they are involved in the services, you can totally provide family therapy. Group therapy, if all of your services are just about groups, that's fine too. We just really want you to write us a robust response and explain to us what your services look like. You know, explain your model to us. Even if we, you know, haven't laid it out here for you, or even if you do a combination of individual, family, or group. So under the BHS service delivery models, we want organizations to provide evidence-based therapies. And again, here's a list of what we've included, but your services are not limited to these treatment modalities. So we have here assertive community treatment, cognitive behavioral therapy, which is a popular one, dialectical behavioral therapy, exposure therapy, functional family therapy, mindfulness-based cognitive therapy, motivational interviewing, solution-focused brief therapy, and therapy that's either asset-based or client-centered Rogerian. Again, it doesn't, you know, this is not an exhaustive list. If you have another treatment modality that you're using, if it's something that's new, but as long as it's, you know, been tested or evidence-based, we are happy to hear about, you know, what's going on in the community in terms of BHS services. BHS program components, you want to make sure that counseling lasts at least 3 months and it can continue as long as 1 year. Let me also add that, again, if you have a model where the counseling does not exactly last 3 months, again, you need to explain that to us, let us know the reasons why, let us know the population that you're dealing with, and if they have special circumstances or special needs. It doesn't mean that you can't submit your proposal, but you just need to really make sure that you explain to us, how your model works. Counseling should be provided at least 4 hours a month or more if needed, and we think that's typical of most counseling programs. Counseling also should be provided in community, which is either at the agency's office, a satellite location, or other appropriate off-site locations. For this year, we are not allowing counseling services to be provided in school. Now, of course, your clients can be youth that are in school, but the counseling services just cannot be provided in a school. And if anybody wants to know why, basically, we underwent a strategic realignment this year, and I think most of you guys are aware of that. And so the Behavioral Health Services Program model is now under the Prevention and Intervention portfolio within the Youth Services Division. And so we just found that we wanted to make sure that we were investing money in youth and trying to make our dollars stretch and to really target youth that were most in need. And also there was a report done by Great Cities, and that report, the findings of that report was released earlier this year, and it found that we had a large amount of opportunity youth living in Chicago, and then also a large number of justice-involved youth. So we just want to make sure that our dollars are reaching the right youth in the city of Chicago. So now our focus populations, services delivered under the Behavioral Health Services contract will focus on providing mental, emotional, and behavioral health services to the following populations, and that is Black, African American youth, Hispanic, Latino, and the homeless or unstably housed. Now, again, let me let you know that this is primarily who we want these dollars to serve. However, we don't want you to turn any young people away based on their race or ethnicity. This is just what our focus, where our focus lies. And the reason being is because youth of color are less likely to have health insurance coverage, and they're less likely to use mental health services than white youth. Also, youth that are homeless are more likely to experience compromised mental health and mental illness, more so than the general population. Okay, so further eligibility requirements, youth must be between the ages of 10 to 24, and they must either lack medical insurance, be Medicaid ineligible, or just have insufficient medical coverage. And again, that's an area where we can talk a little bit more about if you are awarded this contract. So I just want to take 1 minute just to remind you that we'll be taking questions at the end. So if you want to type your questions up, feel free to do so. But again, we will answer the questions at the end of the presentation. So here are some of the outcomes that we're looking for in terms of the BHS services. So universal outcomes and outputs measures apply to all awarded programs under the BHS RFP regardless of focus area. So these are going to apply regardless of the focus area you're applying for. The expectation is that counseling administered under the Behavioral Health Services contract will help youth achieve positive gains in at least one of the following 6 areas. So family functioning is big. Youth should show an improvement in their family dynamics, improvement in their interpersonal family relationships, and an overall improved outlook on their family life. Peer relations, youth should have stronger and healthier peer relations. This can be exhibited in many ways, including decrease in arguments, fights, and other behavior that result from negative attitudes, associating with an improved group of youth who are involved in positive activities, and ability to develop healthy social attachment with peers. Community attachment. Youth should show an awareness of their place in their community by understanding the effect their actions, whether positive or negative, have on the community. They should also show an increased interest in adding to their community in positive ways via community service and other service learning projects. In cases where the youth's criminal activity has caused a breach in their community relations, youth should show a desire to restore the community's trust in them and a desire to refrain from similar actions in the future. Individual behavior. Youth should show an improvement in any of numerous negative behaviors they may be exhibiting upon beginning counseling services. Broadly, they should show a desire to make better choices and demonstrate that they have acquired skills and coping mechanisms to help them do so. Academic achievement and school readiness. Youth should show an improvement in school-related behaviors such as increasing attendance, decreasing detentions and suspensions, increasing engagement in class and the broader school community, joining any number of school-focused activities and extracurricular activities, improvement in grades, willingness to exert effort in the achievement of school-related goals, and an improved outlook towards school in general. Reduced recidivism. Youth should have reduced contact with police, reduced arrests, and reduced incarceration incidences. Okay, so we just talked a little bit about the universal outcomes, so now we're moving on to outputs. And so these are some of the outputs that we're going to be asking you to track if you are awarded the contract. Number of eligible youth who receive an initial assessment for mental health counseling services, number of eligible youth who participate in developing treatment plans with their therapist, number of eligible youth who engage in mental health counseling for at least 3 months, number of eligible youth who complete their mental health counseling, number of eligible youth who participate in developing transitional plans with their therapist. Okay, these are more program-specific outcomes and outputs. Program-specific outcomes and outputs are applicable and tailored to awarded programs under the BHS RFP for specific program areas. In addition to the universal outcomes and performance measures, awarded agencies will also be responsible for outcomes that are directly related to the counseling program they are administering. So although they may not be listed right here in this presentation, depending on which model you apply for, and again, if awarded, we will be discussing additional outcomes and performance measures that will be required. Successful respondents are expected to propose anticipated outcomes and performance measures for the programs they are applying for. All right, so delegate agency qualifications. Before I go through this, let me just say that we are looking for qualified staff to provide clinical services to our young people. So we want you to be a mental health professional, an individual who possesses a bachelor's degree in counseling, social work, psychology, or related field. If you do have interns, that is okay. We just want to make sure that your interns are being supervised properly by a person who is a master's level clinician with a license. And so your qualified mental health professionals are your staff who have at least a master's degree in social work and who are licensed under the Clinical Social Work and Social Work Practicing Act, or are licensed under the Professional Counselor and Clinical Professional Counselor Act. And it has to be an individual possessing at least a master's degree in counseling and guidance, rehabilitation counseling, social work, vocational counseling, psychology, pastoral counseling, or family therapy or related fields. So again, what all of this means is that we know that there are some people out there, and which is fine, but not for the purposes of our program. There are people out there that may call themselves counselors, but if you do not have the correct training, education, and credentials, then those individuals are not fit to counsel our youth. In keeping with delegate agency qualifications, of course, we have the clinical psychologist who, again, has to be licensed in accordance with the Clinical Psychologist Licensing Act. We're looking for psychiatrists. Psychiatrists must have completed a residency program in psychiatry and must be accredited by the Accreditation Council for Graduate Medical Education or the American Osteopathic Association. And then I mentioned supervision earlier, but again, anybody performing the work needs to be, is required to have clinical supervision to be provided by a person who, again, is either a licensed clinical professional counselor, licensed clinical social worker, licensed clinical psychologist, or psychiatrist. And all of these definitions are in the Mental Health and Developmental Disabilities Code. And you can find these guidelines within the Illinois Department of Human Services licensing requirements. Okay, let's talk a little bit about BHS selection criteria. And so you see four areas there on the screen. So previous program experience, which is very important, program design and administration, again, very important, your administrative and fiscal capacity, as well as your budget. So what I'll say about these areas is that this is DFSS's universal scoring system. So all of the RFPs that we receive, this is how they're all evaluated. But the difference is, of course, under each of these categories, we have questions that we're going to evaluate you that are going to be specific to behavioral health services. And the questions, again, are tailored to each program. And we operate on a point system, but the questions that you're going to be evaluated on should be contained in the content of the RFP, and you should be able to see them once you access the RFP if you haven't already done so. In regards to the budget, again, this is a mental health, a counseling program, and so let's say you are conducting art therapy, which was not on our list, but like I said earlier, you know, if you are providing a unique method of counseling services, that's fine. You can still submit your RFP, but I picked art therapy because that's the first thing that came to my mind. And so with art therapy, you may need some supplies, some kind of, you know, I don't know, artistic supplies that will help your clinician to perform his or her job. And so that's fine if you include those materials and supplies on the budget. But my whole point in mentioning the budget area is just really to say that if you are providing counseling services, then we really don't want to see basketballs on your budget, not unless, you know, there is some form of therapy that specifically, you know, includes the use of basketballs. But again, you know, my point is to make sure that you keep your budget very clean and tailor it to your counseling services that you are providing. Please let us know. I know I'm like skipping all over the place, but please let us know about your previous program experience. It is important. You know, we like to hear about your success stories. If you could provide us with numbers of young people that have successfully completed goals that, you know, are contained within their treatment plans, we want to know about that. Again, if you have a unique program design, that's what we're looking for. We're really looking to you guys as the experts. You have to tell us what you're doing. You know, we are the holders of the money, so to speak. However, you are the experts in designing and administering the programs, and so we do look forward to receiving your proposals. This is further talk about just budget and contract term. And so basically, I know that you must be thinking that it is December 20th, and this program, the contract term is January 1st, 2018 through December 31st, 2018. But it's okay. Yes, it's December 20th, but the contract term in front of you is indeed correct. Want to let you know that although the program is for 1 year, DFSS at our discretion may extend the term for up to 2 additional years, with each extension not to exceed 1 year. Okay, so let me explain this. What this means is that if you are awarded the contract for the entire year of 2018, January to December 31st, then if you are, if your performance is good, and if we have the money, then we have the ability to extend you until 2019, and so you'll receive the contract for 2019. And then if in 2019, again, things are still good on all ends, then we can extend it to the year 2020. But what it does not mean is that if in 2018 you're doing a good job and we have the money, we're just not going to automatically extend you for 2 years. So that's what it means when we say each extension is not going to exceed 1 year. And so DFSS anticipates funding 6 to 12 agencies, and the awards are going to be between $75,000 to $150,000. Again, payments are based on reimbursement only. We will not be given any funding advances, and as I mentioned before, the budget should support the program needs. So now we've gotten all the way to the new e-procurement application system. So first, I want to say that I am learning this system along with the rest of you, but we try to make this as easy as we could, and we know that everybody's in a learning curve right now. However, the easiest way for me to explain this is first and foremost, if you look at the bottom of the screen, we did provide the link directly to the BHS RFP, okay? And so I know that some of you have emailed me and said, hey, this link doesn't work, and I apologize. I don't know what happened. It is the same link that I sent out the first time, but this is like a refreshed version. And so if you click on the link, you should be able to not only see the BHS RFP, but there's some other RFPs there, but it allows you to click this one. And let me let you know that if you haven't gone in recently, we did attach the PDF. Like once you access the link, the PDF is now linked to the RFP, whereas before, I don't know, it got lost somewhere, but it's back up and running now. Please pay close attention, because if you are a new vendor, then we put the link here for you to register at cityofchicago.org/eprocurement. Existing vendors, you have another way that you must go in and register to use the system. If you have any questions at all, I know I've been getting a lot of questions, and I've been sending out tutorial videos, and it has helped some. You know, it takes a little time to, to view and learn through those tutorial videos, but they are helpful. So you can either let me know, and I can forward you some links, or there is support available once you get into the iSupplier e-procurement system. There should be a way to access a help desk. So our timeline, so we issued this RFP December 20th, and of course today is, we issued the RFP December 12th, and today is December 20th, and we're hosting the webinar. The deadline to submit the proposals is January 19th at noon. Now let me go back and say that when the RFP was initially released, there was a mistake, and I believe it stated that the proposals were due on December 25th, which is Christmas Day. And so I know all of you nearly passed out, but yeah, and we passed out too. But that is not the case. It was an error. I have been emailing a lot of you to make you aware of the error, but for those that have not heard, everybody who is going to celebrate the holiday, you can do so, and be relieved to know that January 19th is the deadline, the absolute deadline. And so, yes, programs, the contract is going to begin on January 1st, and we can talk a little bit more about that later, and again, if you're awarded. But award notifications, please don't quote me on this, but we anticipate sometime probably late February that you will be notified, but again, don't hold my feet to the fire. Our next slide, Kia Coleman, which is my director. You can reach out to her if you have questions, or you can always reach out to me. And I would say actually just reach out to me. If I'm not available, then use Ms. Coleman as my backup. But as many of you know, I do try to get back to everybody as quickly as possible, and I try to be helpful when I can. So thank you, and that concludes the PowerPoint presentation. And now I'm going to read through the questions and hopefully provide you guys with the answers you're looking for. Okay, so our first question, the question is, we work in a very under-resourced community and transportation is often a problem for families. We always schedule at least 4 hours of service per month, but we don't always achieve that due to these barriers. Could you discuss what the potential implications of this are? We do document failed, canceled appointments. And so my response to that is that I've heard that that's a frequent concern for agencies that do provide counseling services. And as mentioned, I would suggest that you do continue to document your missed appointments, your failed appointments. And then again, if awarded the contract, what I would do is make sure that you keep in touch with me. I'm going to be your point of contact for the Behavioral Health Services Program. So let me know, and we can discuss moving forward any, any ideas that we may have or any additional things that you can do to help address those concerns. And so basically the bottom line is I would just say always just keep DFSS informed of what's going on with your program. The next question is, our workforce program uses a space at a city college. Will we be able to use a space there, not classroom, to meet with program participants, primarily ages 17 to 24, excuse me. And so I would say yes, if you have an agreement with city colleges to use space. Again, when we said that program can't take place in schools, I was really talking about like elementary schools or high schools during the course of the day. But if that's your space and you have, like I said, an agreement with city colleges, that would be fine. Moving on to the next question. For clarification, there are 6 focus areas, but we could also choose to apply for general mental health, which is an area in addition to the 6 focus areas, correct? Yes, that is correct. Okay, next question. Are psychiatric nurse practitioners also approved provider type for psychiatry services if they are working under the supervision of a psychiatrist? And so I am going to say yes, because I know that, well, we have found that psychiatry services are very limited, not only here in the city of Chicago, but nationwide. And I know that some organizations even use the telepsychiatry model. And so if this is how you guys have found, a way to provide psychiatry services for young people through your nurse practitioners, then yes, that's fine. Okay, our program works with children who have severe trauma histories, and course of treatment can take longer than 1 year. Based on the program, will the children who are in care over 1 year no longer qualify for this?
This is Kia Coleman, so Rasan and I are looking at each other here. The answer to that question is that going back to Raisana's explanation about how we award contracts or extend and amend contracts. So if you have a contract and you're servicing a client, and then we are able to extend the contract for another year, you may continue to serve the youth that way. We do not have a problem with that. We gave the year boundary because that is all that we are able to guarantee as a contract, just under the way that the city's contracting process works. But if your model absolutely depends on needing the city, this, BHS contract to go more than 1 year, then I would say not bank on that, because we can never guarantee anything longer than the year that you are initially awarded. So that would be the contracting answer. The service answer is, if you have a contract longer than a year, you are able to serve your youth for longer. All right, the next question. Good morning. How many youth are expected to be served by each agency through this program? So this is what Raysana was saying. We have, for this particular RFP process, we have switched it up. We usually are very prescriptive about, what we say, how many people need to be served and when, et cetera. This is one of the few cases where we are actually asking you to give us those answers. And that is because we did a series of surveys and focus groups with a variety of different people, plus Raysana did a lot of research about the way that contracting for mental health services is done nationwide and what some best practices are. And one of the things is that because there are so many different ways to provide therapy effectively, we heard that the best thing that we could do is provide some very high-level parameters and then allow for you all to propose to us what services you already offer that you would like to expand, or a new initiative or program that you would like to start. And so in this case, whatever your program model is, make sure that you propose to us how many people you're going to serve and how long you're going to serve them and in what way you will serve them. The only thing we can say is, of course, the responsibility is on you to ensure that it makes sense and passes the sanity test. You don't want to send us a proposal just to be extreme, in which you say, for 1 year, we're going to serve through youth. It may technically be something that could be effective, but it wouldn't make sense. So just design your proposal in a way that makes sense, and you will tell us all of those metrics.
Okay, next question. Can the youth in BHS be involved in other DFSS programs? And so this question makes me cringe just a little bit, and I will tell you why. So overall, the answer is yes, but that is a light yes. And the reason why I say that is because in the past we have told organizations that they could do this, and unfortunately there's sometimes always, one bad apple that tries to go and get all of their youth from an existing program and put them into, the newly funded program, and we don't want that. However, we do not want to tell you that no other youth can be involved from other DFSS programs, because this is a service, you may just have an out-of-school time program where there is a young person who is, who has some behavioral issues, and they would be a good fit for this program. So I don't want to cut you off and say, no, you can't do that. But, just be selective and be mindful that this is additional funding, and, and that we have provided you with other contracting, and we want you to try to expand, your services as much as you can. Okay, in past years, grants were awarded at $1,000 per youth served. Will that be the case this year? So I think Kia just covered that, and so yes, that was the model in previous years, but that's no longer the case. Okay, I thought I saw somewhere the applicants must have 3 years of experience providing clinical services. Is that correct? Our program is a bit newer. So yes, you did see in the RFP where we were requiring at least 3 years of experience. However, I would encourage you to go ahead and apply and add all relevant information, research that has been done, your successes so far, you know, please let us know about those things, and your proposal will still be considered for funding. How many programs are currently funded for these services in 2017?
This is a little bit of a tricky question to answer. This is a new way of delivering the BHS services. So we are not, I mean, technically we're not funding any programs for these exact services in this current year. If the question is just how many BHS agencies are there currently, Raysana and I can follow up with you offline about that.
Can funds can funds be used to support a clinician and a psychiatrist, more than one clinical staff member? The answer is yes. Knowing that this is reimbursement, can you speak a little to how that will work, especially for any expenses outside of counseling hours? So I'm going to suggest that whoever has sent that question, can you send me an email on the side to my email that's on the screen, and I'll be happy to, Key and I are going to discuss the answer to that question, and I'll get back to you shortly. If our organization focuses on youth that are 18 years and older, is this okay, or must we serve 10 to 17-year-old youth also? No, you can focus on 18-year-olds and above. If requesting funds for general mental health and one of the 6 key areas, are we required to submit 2 separate proposals? Yes.
And let me step in here really quickly just to remind everyone that only up to 60% of the proposals that we award will be awarded for general counseling services. And it's not like any of you, including us, we don't know who's going to submit what. So if every single proposal we get is for general counseling services, we're not going to make awards for all of those. So we encourage you, we find general counseling services to be extremely valuable, of course, but in an effort, as Raysana explained earlier, to sort of target and expand our service provision, we are also asking for specific counseling services. And so just be mindful of that, you know, there are a limited number of general counseling services awards that will be made. If the contract is not granted until March, but the grant period starts in January, should providers use CitySpan in the meantime? No, because you don't know who, there is no, you would have no idea who you are as a successful respondent. So we are going to do our best to make the announcements and get all of this done and let everybody know who is awarded as soon as possible. But, you know, we have a system that we work within that takes a little bit of time. So with that being said, we just encourage you to be patient and to wait until we get to you. But you will not have access to CitySpan because no one will be awarded the contract, so you won't be able to use it. And then the last question is, can the PowerPoint be shared via email? And the answer to that question is yes, absolutely. And Raysana will also be able to share the link to the entire webinar. Okay. Not the last question, sorry.
Okay. Oh, she already asked it. It says, I think we have reached our last question. Let's see.
Okay, so the question is, for CitySpan, would you have to enter data retroactively? Again, you won't know that you have a contract for us. So you won't be able to start services. The contract period is January to December, and we say that because that is the year period. We contract January to December just as a general rule. The truth of the matter is that you won't be able to start your services until we actually let you know that you have been awarded. Because let's say that you apply for, you send in 2 proposals, one for general counseling and one for anger management, we could award you for one of those and not the other, and you won't know that. And so it's not like you can say, oh, we've been operating this already. So what I would say is just wait until you understand if you've been awarded, and if you've been awarded, we will let you know at what point you can start expensing to that, to the grant. And if there's further questions about that, Raysana and I can answer offline.
Okay, next question is, should budgets reflect a shortened delivery period?
Please make your budgets for 1 year.
Okay, next question. Good morning. Must clients be considered new to the proposed program? For example, if the program is existing, but we would like to further develop scope of services through the contract funding, are these existing youth considered as participants under this project? And so the answer to that is, for us, so ultimately, yes, because we wouldn't know, if you're new to DFSS, we wouldn't know whether or not you were working with those young people or not. So for your agency, if you already have funding that exists and you're able to provide services to those youth, I would say that then this funding should allow you to expand the services and, add additional youth. But if that's not the case for whatever reason and you do need to count some of those youth, then that's fine, unless, like I said before, you were already getting DFSS funding for another program. We don't want you to dump all of those kids from an existing DFSS program into this contract, but if it's already clinical services that are being delivered and you need to count those participants, then you do have the ability to do so. Okay, so is there a staff required ratio per client for this BHS contract? So this just goes back to what Kia was saying, Kia and I were saying before, and this is an opportunity to let us know, your best practices. Mm-hmm. Okay. Yeah, so I think we've reached the last question. If we can give you guys like 1 more minute to submit questions. Otherwise, we're going to end the presentation. Okay, thank you. We have another question that popped up, and the question is, can multiple awards be granted to the same agency? And the answer is yes. We know that some of you are from large organizations, and so we could possibly fund different sites, or even if you're not a large organization, but you have 2 different program models that are existing, yes, you can still submit your proposal, and they may be granted for the same organization, more than one. Okay, another question. If we submit under multiple focus areas and or general counseling services, could we be awarded in multiple areas, or would you be choosing one? How should budgets differentiate? So this is kind of going back to what I was just saying. So the answer is yes, you could be awarded in multiple areas, or one could just be chosen. And then how should budgets differentiate? Again, for each model that you propose, you would need to submit a separate budget. And so, and it's at your discretion to, again, let us know what you would be using the funds for in each of the respective budgets that you submit for each of the respective proposals that you submit. And I believe we have reached the end. That was the last of the questions, so thank you so much for participating. Again, Kia's information is on the screen, and so is mine. Feel free to reach out with any questions, and otherwise, I hope that you guys enjoy the remainder of your day. And again, thank you for participating.